As I said, people call you the unicorn. And our first question, they said, for the unicorn, what is norovirus? The doctor said this is what my son has. What on earth? It sounds horrible.
Well, it certainly can be, but it's the routine garden variety stomach bug, talking
Okay.
about the
Oh,
virus that causes stomach flu. So it's a very contagious virus. It can affect anyone, and basically it causes your stomach and your intestines to get inflamed and upset. So as we think of stomach flu, the nausea, vomiting, diarrhea, that's what it causes. And there's been a particularly bad a type of norovirus going through the Sacramento community where I live now. And
I think it's here too. So I have a feeling it might
oh,
be everywhere. And
yeah, yeah. And you can get it from an infected person. Obviously, you want to use universal precautions around any bodily fluids, but you could also get it from contaminated food or water, or even if the virus is, on the countertops or whatnot, you could use some bleach spray or whatnot to try and decrease exposure to the virus. But the biggest thing, of course, with stomach flu is to stay well hydrated.
okay.
And I am a big fan of Pedialyte for that. People can go several days, even children can go several days without food, but we absolutely have to have those fluids so we don't get dehydrated.
I'm so glad to hear you say that because both knock on. I have to find some wood somewhere. I've not had it yet, but both my husband and my son had whatever the bug was recently, and we always keep the Pedialyte. That's the one that doesn't have any artificial colors or
Right,
flavors in it,
right.
which I really like to have. Around for an emergency. We just keep like 2 bottles of it under one of the sinks in the bathroom so
Good
that it's there.
idea.
And but I said when I took him to the pediatrician afterwards to just see that he was okay, I said, all he's had is Pedialyte, and he said, he's almost 13 years old. You're giving him Pedialyte, and said that I said, well, but it hydrates. It even says on the bottle it hydrates better than sports drinks and better than water. And when
Mhm.
you've lost stuff, I think you got to put stuff back in, right?
Right, absolutely.
Okay, so
We,
I
we
love it.
keep, my husband and I keep emergency Pedialyte for ourselves, and my husband's grown to like it as a drink.
There, that's not good. I can see I'm at the bar ordering a scotch and Pedialyte. That
Right.
won't go over well. Okay, but so is that the main thing then to do? Is there anything else that we can do when we have the stomach flu?
Supportive care. It's small sips of liquid, taking a sip right after you've thrown up, because that's the best time to keep it down. And just small sips. If you chug it, a large volume is likely to come up again. And then you
Okay.
have to keep up with the fluid loss with the diarrhea and rest. I have to confess, I hadn't gotten sick in a long time, but about 6 weeks ago, I got the stomach bug,
Okay.
and I had to stay in bed 3 days.
3 days. Okay. Gosh, not fun. Not a good time. But and is this the thing that they end up having on cruise ships when a cruise ship?
Yes, a lot of
Okay.
times it's various stomach flu bugs. Yes, various
Okay.
viruses.
And then once you've had this, does that make you okay? Are you still
That
susceptible?
we know because
Oh,
the viruses mutate and
okay.
they learn to adapt. Plus, there's a variety of them that can cause, but noro is a big one.
Okay. Great. Well, moving on to the next question. Dr. Copeland, what's the best way to treat eczema? My daughter's pediatrician prescribed a steroid, and I'm not sure whether to use it. The pharmacy said I can only use it for 5 days. Then what?
Okay, that's a huge question, and I'm not sure if the writer means a steroid by mouth or a
Oh,
topical skin cream or skin ointment.
oh,
And really, it's important not to be afraid of steroid creams and ointments. That's a big part of treating eczema. So, what eczema is? There's different types of eczema. It's also called atopic dermatitis, where atopy refers to it can be allergy based. But eczema is a recurring dry, red, itchy skin that gets very inflamed. And it's really key to control the dryness and the itching. Dermatologists often call it eczema the itch that rashes. So if the child itches enough, even if there wasn't a rash there, they're going to create a rash. So steroid creams, prescribed carefully by the doctor and used according to directions, are really important. The American Academy of Pediatrics says they're probably underused, and they can actually really control the inflammation. Now, it's possible that with a more severe form of eczema, if it's really generalized redness and abrasions and irritation, inflammation on major areas of the skin of the body all over, that the pediatrician might have given an oral dose of steroids. And when you take steroids by mouth, we don't want to do prolonged use. So it's typical to give a 5-day course. And that's what we call an oral steroid burst. If you go longer than that, steroids can suppress the immune system, but short term, they're great for taking away inflammation. So it's important to follow the doctor's instructions to get the acute redness and inflammation treated and healing. And then the trick becomes when the mom asks what else. That's a very important question, because you want to try to prevent those flare-ups. And there is a website. It's nationaleczema.org, all lowercase, one word. And it goes over, some of the standards. You want to take tepid baths, not excessively hot, because that'll irritate the skin. And you want to pat dry, not rub dry. You want to avoid irritating soaps, lotions, anything with perfumes or dyes. Stay away from that can trigger the eczema. So you want hypoallergenic products like Dove soap, and you don't want to leave the soap on too long. You want to rinse well, pat dry, and then you really need to moisturize the skin with some good hypoallergenic moisturizer, maybe something like Aveeno, and even Vaseline can be helpful for moisturizing. And then another important point with eczema is we all have bacteria in our skin, but when the skin becomes dry and red and raw, more bacteria grows and it becomes a vicious cycle, triggering the eczema. So it may be important to reduce bacteria on the skin. And if there's just isolated patches of red eczema, you could do that with a prescription antibacterial ointment. It's called mupirocin, and the trade name is Bactroban. The doctor can prescribe, and you can just put that on twice a day to the patches. And anytime it starts to flare, you can immediately start that, as well as with some topical steroids. But for more severe generalized eczema, to decrease the bacteria, dermatologists will sometimes recommend a bleach bath. You have to do it carefully. It's like 1/4 cup of bleach to half a tub full of lukewarm water. You got to fill the tub up a good halfway full, and be careful not to get that bleach water in the eyes. But soaking 10 minutes in that bleach bath, and then rinsing off thoroughly and patting dry, that decreases bacteria on the skin too. So moisturize, treat the itch if need be. Sometimes the child has to take Benadryl for anti-itching, like an antihistamine. Those are the mainstays. About 1/3 of eczema could be due to food allergies, and eggs are a big culprit, but that's only 1/3 of eczema. So I hope that helps, gives some tips.
So very interesting. Somebody wrote in and said, "Hi Shannon and Dr. Unicorn. Thank you very much for your answers on the 2/16/16 show, catching up on the shows." And they said, "Thank you, Kelby. Learning from all the questions you answer. Thank you for explaining medical issues in plain English, and appreciate Dr. Copeland's approach of care in the minimally invasive way as possible. Thanks for answering my questions about the probiotic. My son's nose starts running on a Claire probiotic, but not on Culturelle." And she said, "FYI, because we had a conversation about this, I just called them to make sure that it's dairy-free, because we had a discussion about whether Culturelle was dairy-free." And she goes on to say that the manufacturer says when they first started, Culturelle did contain dairy. They changed their formula about 5 years ago, and it no longer has dairy. My girl and I take Claire and we're fine, but my boy's nose just runs away if he takes it. He's so sensitive he can tell you that there is a cat in the house without seeing it. And she said, thanks again. You are the Ellen of the autism world. Make the world a better and friendlier place, and for making us laugh. So thank you, Dr. Copeland.
Thank you. Wow.
Wonderful. And I it's funny because I can tell if there's a cat in the house too, because I start to well up. It's interesting to me that they allow cats on airplanes. I was once sat next to a woman who had her cat underneath the seat, and before we even took off, I started wheezing like a crazy person, and they had to move me. And it occurred like nobody had ever had an issue like that before. I'm sure they do.
Yes, yeah.
But doesn't that strike you as being weird?
Sensitivity to cat dander is common.
Yeah, pretty weird. Okay, so ongoing. Dear Shannon, at Dr. Copeland's The Amazing Unicorn February Q&A, you had mentioned if Jem had an infraction with gluten, you would know. What symptoms does Jem feel or see? My boy on occasion gets an uncontrollable jaw movement. I'm guessing it's yeast. Do you or Dr. Copeland have any idea from your experience? He is exhausted after trying to control his mouth from opening uncontrollably, and she said, thank you. That's our haircut mom, and her son is 15 years old. I just want to say that for when Jem was little, if he had something that had gluten, I could tell it because we lost him. He tantrumed. The eye contact was impossible, and speech went completely away. Later, we've only had one infraction that happened later, and he had both gluten and dairy, and he broke out in hives, and I honestly don't know which one caused that. But he did break out in hives from it. And we haven't done another challenge, but nothing like that. And the uncontrollable jaw movement, Dr. Copeland, what do you think about that? Because I've never heard of that tied with yeast.
I have not either. And I think it would be unlikely. And I think it would be unlikely tied in with the gluten sensitivity either. Gluten sensitivity can do other things, we know, but I think that would be unusual. So it sounds like either a musculoskeletal or a neurological issue. So in terms of the musculoskeletal system, we have this joint here with our jaw, the temporomandibular joint, and if it's causing problems, pain, discomfort, the person might feel compelled to open and close the jaw. And we call it TMJ syndrome or temporal mandibular joint syndrome, and that can be treated either by a doctor and or a dentist. So they may want to have this young man checked by both his doctor and his dentist. But the other thing is that if it's not dental and not the TMJ joint, it could be a neurological tic of some sort or a neurological movement disorder. You can get a dystonia. It comes from the brain and it involves the regulation of the muscles of the jaw. But usually that presents as difficulty opening the mouth wide enough rather than repetitive opening in terms of dystonia. But a neurologic tic could cause this repetitive movement. And I would definitely bring that up with the physicians to see if the child might have an intermittent tic.
And which physician would you go to? Just your run-of-the-mill, for a 15-year-old, is that the pediatrician?
I would start with the child's primary care doctor, which is likely a pediatrician or family medicine doctor. And if they're not certain, or if they recommend, then could possibly a referral to a neurologist.
Okay. Not to get concerned or anything, but to follow it up and see what it is that you're looking at. It's interesting because last Wednesday on Ask Dr. Doreen, somebody wrote in a question about teeth grinding, and it led to a whole discussion of, the TMJ, excuse me, but we don't think this doesn't fit that sort of symptom. Not really, you don't think, or you're not sure.
Well, it's more common to have teeth grinding with TMJ, but sometimes the pain or discomfort or unevenness in the TMJ joint might kind of compel a person to open and close their mouth repetitively.
Okay. All right. And then, to this viewer, write back and let us know what you find out, because it's a pretty interesting thing.
Yeah.
Okay, and then another question here. My son says that he, in quotations, sees colors sometimes when he stands up. Is that just being dehydrated? Is it something I need to be concerned with and talk to my pediatrician about?
Well, my thought on that is how long does it last? And is it associated with any other symptoms like headache or feeling dizzy and lightheaded when you stand up? I actually, when I first read that question, I went, oh, that happens to me. And I never thought anything about it. Once in a while, when I stand up, I'll just for a half second or so, I'll see a little rim of green and gold. And I think I'm just getting my bearings. And it's over with so quickly, and I feel fine. So if it's just very brief and he has no other symptoms, then it's probably not to worry. But if he's feeling dizzy or lightheaded, that could be associated with dehydration, and especially if he has other reasons where dehydration might be an issue. Either he's been sick or had a fever, or he tends to run warm. It's hard to get him to drink enough liquids. And certainly if there's headaches, recurrent headaches can be aggravated by kind of a mild chronic dehydration. So encouraging more fluids and water. Also, sometimes right before a migraine headache, people can see flashing colors, and it's kind of the first sign that a migraine might be coming on. So it really depends on what's associated with it.
Interesting. And so there's nothing wrong with then, for you, for instance, when you stand up and see the green and gold, there's nothing wrong with that. That's not something that needs to be addressed.
I never even thought much about it until I read the question.
Well, now I'm worried about you, Dr. Copeland. And maybe that doesn't happen for me, although I have had in the past migraines where I've seen the flashing in the side of my eye. In fact, the other day, we so very rarely get lightning here in Los Angeles, and I was up the other morning, and out of the corner of my eye I saw a flash, and I went, oh, I haven't had a migraine in forever. Am I really about to get a migraine? And it was lightning.
It really was lightning.
It really was lightning, and I went, oh, because then the thunder came like 10 seconds later, and I thought, oh, well, I guess we're having lightning and thunder and not a migraine. But I have experienced that, but it's literally like a flash bulb, like lightning. For me, It doesn't have colors. So seeing green and gold is
interesting. The color that I experience once, and I don't get it all the time, but once in a while I'll stand up momentarily, and it's very faint. It's kind of pretty, and it's like a split second, probably not even a full second. And I never really thought anything about it until I read the question. I went, oh, well, maybe, I wonder if that's what they're experiencing.
And I'll tell you what I thought of when I read the question. For our viewers who, we've had Christina Adams on the show before, and she's going to be on the show in just a couple of weeks again. She's the author of A Real Boy, which it's my favorite and first book about autism from a parent's point of view. And she was a card parent, and it details everything that she went through as a card parent with her child and how he was doing it. And there's a point in the book where her son describes to her that he sees things, conversations, and music in colors. And there's a name for it. I don't remember what the name for it was, but it's this interesting moment in the book because he says this, and the mom and the dad are sitting with him at the table, and the dad's like, what are you talking about? You see colors? And the mom says, no, I see music and colors too, that it's just how she visualizes it. And so when you said, yeah, when I saw that and I said, see colors, I was like, oh, I don't. And you said, yes, when you stand up, you see green and gold. This is outside my experience. But I'm glad that you can relate to it, because clearly you're okay.
Yeah, for me, I think it's pressure changes because I feel it too. It's like I'm going from laying flat to standing upright. My heart and blood vessels are adjusting. I feel the pressure on my feet and legs, and it's like this momentary, very brief.
But that's okay. That's not like a blood pressure problem.
No, because it's so momentary. Now, if I were dizzy or lightheaded, that would be different.
Okay. Wonderful. In the news today, we're about to cover a story, Dr. Copeland, of a new study that has come out of Sweden that talks about the life expectancy of individuals who are on the autism spectrum. And it's some pretty harrowing information, especially for a parent to hear. Wow. That for people with autism that also have a learning disability on top of it, the life expectancy is 40 years. And
And
for isn't that
wow.
horrifying? And this was 2 years worth of study in Sweden, and they discovered that for individuals who don't have a learning disability with autism, that the average age was 54 life expectancy in Sweden instead of 70, which is the norm in Sweden,
Oh my
which was
goodness.
really devastating. And they said that individuals with autism were more likely to have a wide range of physical diseases, including heart disease and cancers. And there's a call now for more research to be done about that, about why. And I just wonder, because to me this is absolutely out of left field. I had no idea. I would have expected if the study had come back and said that individuals with autism are more likely to die young because of something like drowning or because they've wandered, that. But I wasn't expecting it from a medical illness point of view, although I know that there is a lot of study being done about immune systems and individuals with autism. But I wondered if you had seen this study, if you had heard this.
No, I hadn't. And thank you for calling my attention to it, because I'm primarily a pediatrician. So I generally see individuals up to maybe 18 to 21 years of age. But I think this is incredibly important. Do you know if the Swedish study looked specifically at seizures? Because I
Absolutely. That's one of the things that is discussed in the study. It's amazing that you would know that. That is absolutely one of the big
Yeah.
concerns.
We do know that for individuals on the autism spectrum, they have a greater risk than the general population of having a seizure disorder. And if there's uncontrollable seizures that can happen at night or whatnot, that will shorten the lifespan. That I was aware of, but I was not aware of the risks of heart disease and cancer.
Yeah.
But as you stated, we know that the immune system is involved in autism spectrum disorders, and the way the immune system is involved differs in the different what we call phenotypes of autism, because autism is not one condition, it's really a spectrum of many different kinds of conditions. But I will find that study and read it with great interest. That's super important.
And actually, in the study, it says for those with an associated learning disability, the leading cause that is killing is epilepsy and seizures at a rate of 40 times more than the general population. And that for people with autism who do not have a learning disability, another key factor is suicide, which
Oh,
is
wow.
a real bright study, but makes our day. I'm being sarcastic there because what a depressing piece of news. But what it does do is give us the opportunity to look into these things more and be more aware and
Right.
potentially turn the numbers around.
And
So,
what is hopeful is, like CARD, for instance, has huge programs now focusing on transition to adulthood and services into adulthood. Because what happens with individuals with autism as they reach adulthood is they have the experience over time where they can recognize that they have some differences. Hold on, the lights just went out here.
uh-oh.
Um, uh, and that can lead to a sense of isolation and depression. So by working early on with skills and social skills, and for the person to accept themselves for who they are and yet have meaningful life experience, I think we can really prevent the depression that gets reported in adults with autism spectrum.
Absolutely.